Hello and welcome to the Metabolic Code Clinical Case Review using the Metabolic Code Report. I'm Libby Bricker, your moderator, and we have Dr. Andrew Heyman with us this evening. Without any further delay, I will pull up tonight's case so we can begin, and at the end of the session, we will break for questions and answers. Thanks for being here, and let's get started. Andy, would you like me to take a look at the questions, or do you want to dive right into the report?
We'll just go right into the report. That's fine.
Okay.
Okay, great. Can you hear me?
Yes, I can hear you.
Okay, great, thanks. So this is a patient of mine who I saw several weeks ago. She's a 38-year-old female who came in complaining of stress and cravings, bloating, maldigestion, reflux, and signs of inflammation. So, you know, she had some joint pain, irregular cycles, low sex drive, basically a positive review of symptoms. So it wasn't clear exactly where she was going to be generating her problems from. And what's interesting with her is that when you look at her total composite profile of her symptoms and labs, look at the left side. You know, so her triad 1 and triad 2 are really kind of in extremis. You know, you think about anything above 500 is significant from our perspective as a total score, and she scored an 875 on her triad 1 and a 685 on her triad 2. So there's something pretty significant going on with her. But what's not clear is still, you know, sort of what are the main drivers. But this gives me a good sense of, okay, she's a triad 1 and triad 2. Very common presentation. Not surprised that she's also invoking triad 5 as well with her reproductive hormones. Go ahead and scroll down. You know, not a lot going on in her triad 3 or 4. And when you look at her overall risk, boy, look at this. I mean, basically everything is in the red. This to me obviously is concerning. She's not someone who has, you know, significant disease currently, but she came to me because obviously she's not feeling well. And so while this gives us an overall view, it doesn't really direct us in terms of, okay, what are the areas that we have to address. It feels like, boy, we're going to have to deal with everything. And this is where she gets even more interesting. So remember, triad 1 was significantly elevated in her composite score. But look at her adrenal, thyroid, and pancreas markers. I wouldn't say that, you know, her cortisol patterning was all that abnormal. You know, she basically has a little bit of a lower sodium. That's it. Her thyroid markers were all depressed, essentially, which sort of makes sense for someone who's under a significant amount of stress. And we don't, you know, but we don't see that reflected in the serum cortisol. Now, maybe we need a saliva cortisol sample. Maybe she's already been high and she's passing back down. And, you know, if we measured her sometime in the near future, she'd have a low cortisol. But, you know, there's not a lot to go on in her stress axis. But something is occurring in her thyroid. So you can see her markers are low and her TSH is slightly bumped. And as far as her blood sugar, not a lot of impact there. Her blood sugar is 90. Okay, not so bad, all things considered. Yeah, her ferritin is a little low at 26. Her potassium is slightly low too. But, you know, there's nothing really to go on there as well. In terms of her gut, her CRP is high, so she's generally inflamed at 4.3, and her vitamin D is low at 21. Her other markers seem to be okay. Her folate was high at 24. She was over supplementing in that regard. So keep scrolling. For triad 3, cardiopulmonary neurovascular, you can see how her cholesterol and LDL were slightly elevated, nothing that I would get too excited about. Her LPA was markedly high at 44.8. That could be genetic, not really sure, but the rest of her markers were normal in triad 3. And then again in triad 4, you know, a slightly subpar hemoglobin hematocrit. Remember, her ferritin was low. RDW, you know, looks to be slightly underfunctioning, but no big deal. Keep scrolling. Kidney function is okay. You know, her BUN, go back up. Her BUN was 11. Her chloride was 106. So, you know, maybe she's losing some muscle mass there. Not sure. Scroll down. And then for her reproductive hormones, her testosterone was slightly above normal. Her total testosterone was lower end. Estrone was upper end, and she had a low LH, so something was going on centrally with her. But by and large, her estrogens and progesterone seem to be okay. So you think, boy, you know, how did we get to such high numbers? Well, you get to such high numbers as a composite score on the symptom side. So obviously, her lab values did not reflect the degree of her clinical state. And interestingly, in fact, it was her triad 2 symptoms that overwhelmed even her triad 1 with respect to significant reflux and bloating, immunopathy, and cognitive decline and depression. So, you know, real activation of triad 2, but almost equally in triad 1, which included, you know, self-reported stress, fatigue, sluggishness, bloating, you know, signs and symptoms that triad 1 is struggling as well. And some stuff on triad 5, especially with that libido. Not much on cardiopulmonary neurovascular or liver, lymph, kidney. So scroll down even more. And we can see how, you know, triad 1 is getting a lot of pressure from the abnormalities scattered throughout all 5 triads. This is sort of that loading algorithm of, you know, every marker potentially could matter across all the other triads, not just within its assigned domain. And this is where she got additional pressure too. And you can see there are quite a few that are assigned to triad 1 and almost an equal amount or more relief for a triad 2. But the weighting that we provide shows that triad 1 is more an extremist with respect to all of the markers that are impacting triad 1, and not quite as much for triad 2. Not so bad for triad 3, all things considered. You know, she does have some cardiovascular risk, but not a ton. And again, not so much for triad 5. Basically, everything sort of aligns within that, and then triad 4 some. But they didn't really amount to much in terms of the scoring. And this is just an exposition for the patient of, you know, what the different labs mean. I think we're all pretty familiar with that. Now, you know, before I get into this, one of the things I would say is that this is a patient who, if you step back, she's got fatigue, bloating, weight gain, joint aches. She was complaining of hormonal imbalances. Her vitamin D was low. Her ferritin was low. And we saw some abnormalities, but we just didn't see the labs that would really reflect what she was self-reporting. And this is a classic patient of mine. It turned out when we did an additional set of markers looking at her innate immune response, which is a pretty progressive set of proteomics, genomics, and transcriptomics, as well as having her undergo a structural MRI for brain, it turned out she was living in a moldy environment, and she had elevations of her TGF-beta1, her C4A, a depression of her MSH, and her VEGF, that in fact underneath the scan of her initial assessment through the triad system, she was having a deeper pathology, which in fact was injuring her brain. We could see brain damage on her MRI due to living in a moldy environment. So what the system did pick up on was the degree to which she was sick, meaning self-report. So when you look at her composite score, you say, oh my goodness, her triad 1 is so high, but her lab markers weren't that bad. And her triad 2 was so high, but her lab markers weren't that bad. And it should make you suspicious that something else might be occurring with this individual. And, you know, in our case, we see so many patients with biotoxic exposures, and this is, you know, something that I'm used to seeing. You know, and even under this circumstance, I think that the triad analysis was very helpful, even though the direct labs didn't really reveal anything. And what's nice about this is when you look at her suggested regimen, as a clinical approach, I would still do a lot of these same things for her, including repleting magnesium, dealing with her stress response and supporting her thyroid, repleting minerals and nutrients, dealing with some yeast overgrowth, supporting her vitamin D, getting her to sleep at night, balancing her immune system with the Modicare, helping her digestion and through digestive enzymes and a probiotic, and then also trying to replace protein. And all of this is important because absolutely a lot of these patients have triad 1 and triad 2 abnormalities. Interestingly, they often have even more triad 2 than triad 1 abnormalities. We, in some sense, saw that as a ranking for her symptom scale, and that's really classic. The cognitive issues, the brain fog, fatigue, joint aches, belly pain, bloating, maldigestion, she really loaded into triad 2, and so this was significantly helpful. And what this particular printout shows is where to begin with a patient like her. Now, obviously, there's a lot more you have to do to kind of solve this case, but the triads were dead on in this regard, even though we'd have to do more blood work on her. And then ending with aged garlic, chasteberry, you know, basically balancing her hormones. You know, some of this I think is probably a little less relevant, but that initial set on the page prior I think would be, you know, really good for her. I probably added maybe a few other anti-inflammatories, but you have to fix the gut, you have to reduce inflammation, you have to clear up her brain fog, support her stress response, and then you can get into dealing with her environment and so on and so forth. Obviously here we have a you know, additional practitioner notes with respect to, you know, going after food sensitivities, which is actually huge in this patient population, dealing with exposures, which we do get to. Detox is really important. Here we have a prompt for check for viruses and inflammatory triggers, all of which is specifically relevant. Here, the cognitive impairment with Cereva, you know, so on and so forth. So, you know, I really like how this organizes itself, because even if you don't know exactly what you're dealing with, you're going to get this person feeling better to some degree as you, you know, tease her apart even further. So I like this case a lot in that respect, you know, because of the prompting.
Thanks so much.
And that's it. You know, I know that, yeah, sure. I don't know if anybody has any questions, but I'm happy to answer, because I know this is a one-off case, but for me a really important one.
Okay, we'll give just a little bit of time to see if any questions come through. I am recording tonight's session and we'll post it on the blog for review later at metaboliccode.com/blog. And it does not look like we're going to have any questions, so we can go ahead and wrap up and plan on meeting again for the next case.
Great. Thanks so much, Libby.
Thank you. Have a great night.
You too. Bye-bye.